Greetings. Thank you for joining. This is Charting the Life Course, Emerging Opportunities to Advance Scientific Approaches Using Life Course Research. My specific topic is From Science to Policy. I am Maureen Black. I'm a professor at the University of Maryland School of Medicine and a distinguished fellow at RTI International. So the objectives is we will talk about advancing policy perspectives in Life Course, and we'll use a U.S. example from Children's HealthWatch and a global example related to nurturing care. A Life Course perspective illustrates that life begins prior to conception, continues through birth, early childhood, adolescence, adulthood, and into the next generation. This is if everything goes well. But what happens is disparities that start very early in life can alter the life course. And as you see illustrated by the red dots, the disparities can increase over time into the next generation, and creating chronic health problems and limited economic potential. So the goal is to look at how we can reduce the disparities. What this slide illustrates is that environments across the life course an impact through epigenetic changes, the health and growth and learning and academic performance and behavior and emotions throughout life. What's key in this is to think about the timing and the quality of the environments and how they shape a child's future potential, because we can alter the environments to enhance or to promote children's potential. These illustrate growth charts, and so we'll just look at how growth occurs very early in life. These are for girls and boys from birth to 24 months. And you can see the slope of the growth that happens very, very steep early in life. If we look at brain development, we also see very rapid brain development early in life. You can see on the x-axis is represented in months. So it starts at conception, goes up by months to birth, up to age 12 months, and then continues on in years. I've drawn a box around the first 1,000 days. That represents from conception to age 2 years. That's 33 months multiplied by 30, and you have 1,000 days. There's a tremendous amount of development that takes place during that first 1,000 days. Synaptogenesis occurs, myelination occurs, and it's very exquisitely timed, so that during this time, children have very specific nutritional and health and environmental needs. If we look at threats to children's development, one that I'll talk about today that's a global concern is food insecurity. This is defined by a lack of consistent access to enough food for an active, healthy life. It's a household level definition. On the triangle illustrates, this is from the USDA, United States Department of Agriculture, that for most of us, it's high food security. And then there's marginal food security. And then it's a much smaller number that are low food security or very low food security. But families, households that are food insecure have risks both for caregivers, and these are things like depression and anxiety, and risks for children. And these are serious health complications or compromising their growth and development. I'm part of a collaboration that monitors the impact of policies and economic conditions on the health of low-income children. This is called Children's HealthWatch, and I'll give you two examples of linking science and policy that come from Children's HealthWatch. We represent 5 medical centers throughout the U.S., Each medical center serves low-income communities. They are in Baltimore, Boston, Little Rock, Minneapolis, and Philadelphia. We work by having ongoing interviews with parents of children under age 4 who bring their children to the emergency department or primary care. We refer to them as a sentinel sample because they're out front with issues regarding their children's health. We have a data set of over 65,000 children. We're funded primarily by grants, foundations, and donations with a headquarters at Boston Medical Center. It's noteworthy that in addition to an executive director, we have a director of policy strategy so that we keep our eye on how our work relates to policies. This is an example from the Supplemental Nutrition Assistance Program. This is how one can protect against food insecurity or alleviate some of food insecurity. These are food stamps, and it's referred to as SNAP. So we know there's evidence that that SNAP, or that food stamps, protect against later metabolic syndrome. And what we see is that SNAP is actually a work support. 55% of households receiving SNAP have earned income. The eligibility for SNAP is very complex. It's based on a formula that fluctuates based on work patterns. And what we also know is that SNAP has very close federal scrutiny. That means that our federal legislators look at SNAP very carefully, and it is often under a microscope. So the goal of this project was to examine if the loss of SNAP relates to food insecurity and to children and caregivers' health. So we have a large data set and of cross-sectional surveys. So we identified, at this point, we had a pool of 41,000 families. So how do we eliminate or reduce selection bias? So we chose families who either currently or in the recent past had received SNAP. So we know that they're eligible. And we chose families where there was a working household member, and we eliminated a number of confounders, or adjusted for a number of confounders. So our analytical sample in this case was a little over 8,000. You can see the consort diagram on the right. And what we found is that the loss of SNAP, well, we'll see what we found. What this shows in the red box represents percentages. So in our sample, we still have a quarter who are food insecure and 30% whose housing is unstable. This is a very, very high risk sample. So we're asking in this sample if they have had reductions in SNAP or cutoff of SNAP. Has that related to children's health or to caregivers' health or to economic hardships at a household level? And what you find is that in many of the areas that we looked at, the answer was yes. So for those who had a reduction in SNAP or a cutoff, that there were adverse economic and health indicators. So from this, we did a policy brief and we did a paper in Health Affairs. Another example is in 2015, there was civil unrest in Baltimore. What happened is that a young man by the name of Freddie Gray was arrested by Baltimore police officers, and in the police vehicle, he sustained neck and spinal injuries and subsequently died. So there were protests citing racism and social injustice and violence throughout the city that erupted. Well, this is a map of Baltimore, and the red stars indicate where the violence occurred. The green dot in the middle is the University of Maryland Medical System. So we were in the middle of this. And the families who receive services, who live in these communities, bring their children to the University of Maryland. We collect data all the time. So we had data before the incident, during the incident, and after the incident. So the question was, how does exposure to civil unrest relate to maternal and child health? So we were able to look at the data the entire year before the event occurred, and then we could look at it in the red box during the and the immediate aftermath of the event, and then we could look at it after the following the event. And what we found is that the prevalence of maternal depressive symptoms in the communities varied by their proximity to the event, to the unrest. So in the blue line, you can see those who lived in an area proximal to the unrest, and in the pink line, they lived more distally. So the rates of maternal depressive symptoms, the prevalence of maternal depressive symptoms increased in the proximal communities. So they increased up to 50%. So we learned that civil unrest exposes caregivers of young children. These are very young children. They're 3 and under, exposes them to depressive symptoms. And we had a separate survey that showed that it was a disruption to family routines and safety that was associated with their concerns and with their depressive symptoms. So this obtained media coverage, and we worked with the Baltimore City Health Department regarding these findings.